The DPCO 1995 has been there for more than a decade. What's the learning? The number of players that they were there in 1995 have dramatically come down. The number of molecules have come down. The number of new introductions in the old DPCOs are less than the products which are outside DPCO. 1/3 of the drugs which were there in the 1995 DPCO have gone to China. So the writing is clearly on the wall that price control doesn't work. And if you look at the global experiences, let's take Canada. When the price control was brought in Canada, in a span of 3 years, the R&D investment came down by 50%. And then you look at the Brazil, you have a similar experience. And when prices were reduced in Philippines by 50%, who benefited? The branded generics benefited. The move was from generics to branded generics. Now we are having a similar experience in India, the reason given to reduce the prices. But really, is that a need? If you look at the history of price rises in India, in the last average about 5 years, the price rise have not been more than on an average about 2%, both in the DPCO category as well as in non-DPCO category. And if you look at the competition, it's very intense. For every molecule, you have not less than 50 brands competing. If that's the scenario in India, where the prices are the lowest in the world, is there a need to reduce prices? Is there a need to bring everything to a single convergent price? Do you want to commoditize pharmaceutical industry? Do you want to play with the lives of the people? Today, we need a different treatment. We need to increase our accessibility. We need to increase our availability. We need to provide healthcare insurance to the people who cannot afford medicines. Almost about 60% of this country's population can afford to have a mobile phone. But there is only 15% of the population which is covered by insurance. Of this 60% of the population which is owning a mobile phone takes the health coverage, I don't think so there would be any need for any price reduction or price control. All then you need is to have a critical mass for insurance. We need to think and debate, how do you get this critical mass so that chronic diseases get covered, so that middle class population gets covered, so that people who cannot afford medicine get covered. I think the discussions should be around partnership. The discussion should be about accessibility. And India has a very good track record of price control, which is self-regulated. I think the government should leave it this method as it is. What we need is to repeal the old DPCO. We need to really ensure that the NLEM-based products are available to a larger population. If that is done by the government, I don't think so anything else do we need in the current DPCO.